Yeah. So vitamin G is really B2. That vitamin works on your liver. So really, a liver problem will create that bloodshot eye. Now, if you look underneath the eyelid, and if you can't really see your own, but if you look underneath your eyelid and it's all red like that, and you slept, that is a major blood sugar issue. It's called hypoglycemia. It's a low blood sugar. So blood sugar problems will create a real deep redness underneath the lid and an irritation of the eye. In fact, it'll feel like you have sand in your eye. Does anyone have that? If you want to feel what that feels like, just eat a lot of sugar, and you'll see it. It's like your eyes get really irritated. Also, usually the person's having a lot of carbohydrates for breakfast, like typical pancake or something carb, and then you're going to get that. So that would be bloodshot eyes. That would be B2 deficiency, which is a liver problem. And then you have yellow eyes. Actually, that's why she did that. Okay, good. So if you ever see someone that has yellow, the whites of the eyes are yellow, that is called jaundice. And part of your fluid from your liver is backing up into the blood, and you're turning yellow. And you see that in little babies sometimes as well. So that's a very toxic situation. It's a liver problem. Now, also on the inside of the eye, it's usually on the inside because the nose is right here. You have a little growth. It's a little flap of tissue. You ever see that in some people? It's like anything like that, that's a vitamin A deficiency. So it's low vitamin A. Vitamin A controls your skin, your external skin and your internal skin up in your mucous membranes, in your esophagus, everything on the inside of the body, all the skin. So if anytime you have problems with sinus, dry skin, growths on the skin, abnormal skin, that would be a vitamin A deficiency. So we have vitamin A, it comes from carrots, but what food has more vitamin A than carrots? Kale. You got it. Now, also corns, like on your feet. Anyone have any corns on your feet? You're not going to raise your hand if you have corns. But also any type of little bumps on the back of your arm right here, those little bumps on the legs. Anything abnormal with the skin, it's usually vitamin A. Now, if you're consuming vitamin A is a fat-soluble vitamin. So you have vitamin A, E, D, K, and F. Those are all fat-soluble vitamins. They come from oils. Now, I find a lot of people consume the foods high on these vitamins, but they don't have the digestive juices to break them down. Does anyone know the fluid that helps you digest fats and fat-soluble vitamins? What's that? Who said that? Bile. Yes, you're right. So we have the liver, which is right here, 3.5 pounds, the size of a football. It makes bile. But I have a confusion. Some people think that means bowel. No, there's a difference between bowel and bile. The bile is more in your intestine. Bile is made by the liver, and it helps you digest fats and absorb fat-soluble vitamins. So how do you know if you have a bile deficiency? Simply if you get bloating when you're eating, and you feel burping, belching, and you have right shoulder pain, and you start having deficiencies of vitamin A and some of these other ones. Another deficiency of vitamin A is you can't see in the dark that well. So it gets dusk and you can't really see. That would be a deficiency. The sinuses, if you have stuffy nose, that's why that kale shake will help you breathe, because it opens up the sinuses. It's a lot of vitamin A. Lung tissue, you need vitamin A for the immune system. But it's so interesting because I have a patient that came in and said, oh yeah, I heard a study that vitamin A will cause cancer. I'm like, what? What are you talking about? So I looked the study up, and is vitamin A and vitamin E. They were both synthetic vitamins. That's what they were using. So, of course, synthetic vitamins would cause cancer because they're made from petroleum. So, you have to realize that you always want to consume plant-based vitamins versus synthetic coal tar vitamins. So, man-made. Yes. Yeah. I think, go ahead.
I'm just manning the mic for her.
What's it?
I'm just manning the mic.
Great. So 99% of all vitamins are synthetic. Centrum silver is synthetic. Nature's Made is synthetic, even though it says Nature's Made. It has a picture of a leaf on it. There's nothing natural in Nature Made. What else? Pretty much all of the CVS vitamins are synthetic. Especially the ones that are high potency.
So are you to say that stay away from all the synthetic vitamins, obviously? So are you saying we're getting these vitamins only from the foods that we eat, period?
Yes, or food concentrates, or vitamins that are whole food concentrates.
And where will we find those?
At a good health food store.
Not GNC?
GNC may or may not have them. I don't know.
Okay. Thanks, Mike.
A very good whole food supplement is made by Code, C-O-D-E. They have a very good line of supplements if you'd like to try those. You can get them at Whole Foods and most of the health food stores.
The key is looking on the back of the label and see if you can interpret anything, because you want the source material. If all those vitamins are exactly 50 milligrams or percent of RDA, or 100% all down the list, we know it's synthetic, because if it was really in nature, it would be 5.67, 42 milligrams or percent of RDA, which is your recommended requirement for your nutrient. So also, if you look at the label, you want to look at, did it come from Brussels sprouts, or did it come from zinc oxide? Zinc oxide is one of the minerals that they put in Centrum Silver. Zinc oxide has been known to cause skin cancer, especially if you use it for sunburn and things like that. Then you have magnesium. There was copper oxide. That's in all the synthetic vitamins too. Those are minerals. Those are metallic minerals. That's used as a fungicide. Copper oxide. Yeah, copper oxide is used as a fungicide for citrus, bananas, coffee beans. Yeah, yet they put them in the vitamins. Magnesium oxide, which is, it causes metal fume fever, which is like a flu-like symptom with metallic taste in your mouth. So you feel like you're coming down with the flu. Potassium chloride is used in water softeners, and that depletes all your minerals. So when you see the label and you see these oxides or these ferrous oxide, which is rust, you're getting metals. They're putting metal in your body. Very toxic, yet they're sold as a vitamin, and they're made from chemicals. So the way it's supposed to work is you have these rocks in the soil that break down, and the plant's roots dissolve the rocks into small particles, absorb them into the plant, and convert them into a plant-based mineral. That's how it's supposed to work. And then you're supposed to consume the plant that's been grown on good soils. We're not meant to digest the soil or the rock. So, a lot of these vitamin companies, they're a little bit lazy, so they go right for the rock, and they just give you the rocks. And then you don't absorb them. Like calcium carbonate is limestone. You're not going to absorb it. In fact, there was something in Washington State where they went to the sewage system and they found all these synthetic vitamins. This goes right through people. And then also, if you want kidney stones, consume calcium carbonate. That's limestone. So you want them plant-based minerals. Now, if you look at the size of these minerals under a microscope, the plant-based minerals are so small, they're 10,000 times smaller than actual metals or rocks. So they go in 100% into your body, into the tissues. Rocks do not absorb, even salt-based minerals like sea salt absorbs maybe at the greatest amount be 4% because they're huge molecules. So the difference between a plant-based mineral and a metallic salt or a rock would be the difference between a golf ball and the Empire State Building. Yeah. So the problem is that the soils are getting worse. In 1965, you would have to eat 1 apple to have the nutrition in 6 apples right now. So the soils are becoming depleted. How many of you have ever been overseas into other countries? Do the food taste better there? Welcome to America. It's just depleted. So it's hard to find good nutrition. Out of all the things that's missing from our bodies, I would say it would be the trace minerals. We're going to talk about that. Trace minerals are needed in very tiny amounts below 100 milligrams. Regular minerals needed in higher amounts, like calcium, magnesium, potassium are just regular minerals. Trace minerals will be iodine, selenium, cobalt, these other minerals. So there's about 74 of these trace minerals that we need. But we don't want to have them as metallic rocks. We want them as plant-based minerals. But the problem is the farmers fertilize the soils with NPK, nitrogen, phosphorus, and potassium. They only put 3 minerals back in the soil. So where are we going to get all 74 trace minerals? Because if they're not in the soil, they're not going to be in the plant. So you're eating empty food. It's the trace minerals that give the flavor of the vegetable. So I was just online this morning because I wanted to get some good reference material from around the world with trace minerals in the soil. Try to find, it's like $600 for a little book. I'm like, I think I'll pass on that. They're like very expensive. I don't know why it's so expensive. But it's even hard to find plant-based minerals even anywhere because they sell them in sea salts. So I found a company that sells them, Vandrum Farms, and they went into a quarry in Utah, and they found 60 million years ago, there's a layer of the earth that they had plant-based minerals that didn't turn into oil. So they took those minerals out, and they liquefied them, and they have them as supplements. So that's the stuff that I recommend. It's called trace minerals, plant-based trace minerals. So I took these minerals. I got
Excuse me, Dr. Berg. What was the name of that company again? Vandrum?
Vandrum Farms.
Vandrum?
Yes. And I actually ordered 25 gallons of it. And so I wanted to test it out on my patients and myself. So I got it about a month ago. I took it on a Friday, Saturday, and then Sunday. And then I wrestled my son, who's 200 pounds. He's like 16. He's muscular. He's in wrestling. I took him down like a rag doll. He's like, Dad, what are you doing? Where did you get this strength? I said, it had to have been those trace minerals. He says, give me those trace minerals. It's amazing. What it does, trace minerals help repair proteins. They actually repair anything that is a foundational protein, like your muscle, hair, brain, eyes, and you need the trace minerals to build those proteins back up. So they're good for repair, and they're good for a burnt-out body. Now, the cool thing about plant-based vitamins and minerals are they're water-soluble, and your body will get rid of anything you don't need, and they come in small amounts. When you get fat-soluble vitamins from the store that are synthetic, they build up in your body, and if you don't have bile, they're going to become toxic in your liver. So that's really the problem. Have you heard that a lot of people are being recommended vitamin D lately? Yeah, that's in large amounts. which is about, what, 50,000 international units? Our bodies can only absorb 100 per day. 1,000 international units per day. Anything extra starts building up really toxic in your liver. If you ever want to look up some interesting data, look up the toxic effects of vitamin D. And you're just going to it's like they have a problem and then they're going to solve it with a sledgehammer. They're going to go extreme the other way and just give you way more than you need. Excess vitamins are just as bad as deficiency of vitamins. So you just want to take a little bit and you want to get it from the food, but the problem is where are you going to find food that has all the vitamins? So I would say the trace minerals are the hardest thing to come by. So those would have to be fortified. And then how many of you have never been to one of my seminars? Okay. Really? You've been to my seminar. Oh, have not been. Okay. All right. Then I want to explain something. Potassium. What foods are high in potassium? Bananas, right? That's 400 milligrams. You need 4,700 a day. It's really hard to get 12 bananas in your body a day. So the problem is if you take this in a normal store like potassium chloride, you're getting this water softener and you're going to create problems with your other minerals. So we have to get this one from the food. And the food that we want to get this from would be the salad, the vegetable, the kale. How many? 7 to 10 cups. It's not hard. It's not hard. You just have to your jaws are going to be really sore all day. And you're going to have to graze. I do about 20 cups a day. But it's only a couple of salads. It's like, big salad. Now, it's just a couple salads that you would eat, one for lunch, one for dinner. This whole cup of salad that people have is just not going to cut it. At the restaurant, they have this little cup, and I'm like, what's that going to do?
I'm sorry, you're talking raw, correct?
You can steam kale, but preferably you want it raw. But what you can do is blend it. I'll give you a card to how to make a kale shake. You take some frozen fruit, handful of kale, you blend it for 3 minutes. It's pretty good, isn't it? Okay, good. Yes.
The powdered greens.
Those are pretty good too, the powdered greens, but just make sure it doesn't have anything extra. You look at the source material, make sure that this is those trace minerals. These are the trace minerals that I have. Yeah, these are quite interesting. You take them in the morning. Don't take them before you go to bed. I already made the mistake. It's just kind of like, okay, I'm not even tired now. But you don't need much. You need 20 drops a day in some water. But I'm excited about that. So if you want to take it to the extreme and really have a good green, I would do a concentrated wheatgrass juice powder. Now that's like going to the extreme, but you'd only need a half a teaspoon a day. So what's that? Not all of them, but a lot of them. Yeah, because in order to make 1 teaspoon of wheatgrass juice powder, it takes 2 pounds of actual grass. 2 pounds. It'd be hard to eat 2 pounds of grass. So you juice it, and then first of all, you juice it, it comes to a little bit of juice, and then you take the water out, and then it comes to a 2% yield. You're just getting a tiny bit. So if you take too much wheatgrass juice powder, it's almost too concentrated. So you just need a little bit, and you're going to get a lot of nutrition.
What about sprouts?
Juicing or consuming? Well, sprouts are little baby vegetables that are 4 days old. That's the peak of where all the nutrition is released. So if you want to have the most nutrition in the plant cycle from a seed to an adult vegetable, a sprout would be it. And what the sprouts do is they give you a lot of phytonutrients, which are plant-based chemicals that give you a lot of other health benefits. Good anti-cancer, good for your eyes, the retina, vision, prostate, breast. It prevents cancer, all sorts of things. So that would be very, very good to do, the sprouts.
How many cups of sprouts would you need to do to get to the equivalent of maybe, if you can't do, it's easier to do a small amount of sprouts versus 7 to 10 cups of kale, no?
I see what you're trying to do. Okay. Now, here's the problem. The sprouts have the phytonutrients. They don't have the macronutrients near like the adult vegetable. I'm sorry. One teaspoon of sprouts is equivalent to 10 cups of broccoli with the phytonutrients. But the best way to do you can do like a greens powder, and you're going to get a lot of vitamins. But sooner or later, you're going to have to bite the bullet and just actually eat the food, the salad and things. But sometimes it's hard. Yes.
Wait, you said greens. So is this any kind of lettuce or
yes?
What greens?
But the deeper green, like the higher quality vegetables or lettuce. Not obviously iceberg, but
yeah.
They're at the farmers market. They have some really good high quality lettuce that you can get from all different mixes, and you can go to Whole Foods too. But some of right now they're doing hydroponic lettuce. I don't think that has the nutrition that we need. Just because I tasted, I'm like, there's something missing here. I can perceive. I can just pick it up like, yeah, that was good. But that's not really doing anything for me. So some of the salads that I get at the farmers market seem to be the good stuff. I go to the one in DuPont Circle on Sunday morning. They have all these different lettuce type bins, and I'm not going to even tell you how much I consume because you're going to go, oh no. But I have basically, one of those little bags, this bag right here? This thing right here? Yeah, the whole thing. I filled it up. That's per week. Of course, I have 12 kids, but no. But we have like 5 people in our family, and they're all like 6 foot something. So we eat a lot of greens. But I pretty much eat the majority of it. So that's how you get your potassium.
A question here, Brother Dr. Berg.
Yeah.
Have you tried the restaurant sweet greens where they have?
Yes, the sweet greens. That's 10 cups right there.
Mm-hmm.
Yeah, that's good. The sweet greens place, you just get the whole salad there. In New York, they have a salad place on every corner. I love that. I wish he would kind of bring them down here. Chopped is good too. Yep. In fact, I had the general manager from Sweet Greens come in my office. I should have bartered with him because I could. Like, can I go there every day? I would live there. So potassium is very, very important because you need so much. If you crave sweets, does anyone crave sweets? Okay, then I already know that you need more you need more potassium in your diet because that will lower your cravings within 48 hours. So you want to do that. It's so interesting because you're going to get all the other nutrients as well. So when you have vitamin A from actual food and you have enough bile to digest it, your skin is going to look really good. Your eyes will look really good. Your sinuses will be very good. There's all these different creams that women use on their face with like vitamin A and like sea salts from the Dead Sea. But what they need to do is to work on the inside out, not like try to rub it into the face. It's not going to quite work. Okay, so we have the eye, and then we have the hair. Now, how many of you know anyone with actually hair loss? Okay, so you have several different problems with the hair. Number one, you have thinning of the hair. That would be more of a thyroid problem, or brittle hair, or dry hair. And then you also have little receding hairline where it comes back like this through here, or male pattern baldness, which is right up here. That would be a adrenal problem. In a female, that's very bad because for some reason, women do not like to lose their hair. They don't like wigs. But right over here, that's what will happen. Just come right up here. That means that the adrenals are stressed out. That means you have too much androgen. That's a male hormone. This will also cause facial hair and acne. If the hair has little patches of hair loss, that's called alopecia. And that's a severe adrenal problem where your body has little cells that are attacking your own hair, your hair follicles. That's autoimmune. So it's adrenal. Now, your eyebrows, if you lose your eyebrow on the outside right here, outer eyebrow, that would be thyroid. Thyroid problem. I don't have that problem. My eyebrows grow too much. My grandfather, he has the bushiest eyebrows. I'm like, great, I have something to look forward to. Do you know one thing that grows, that collagen never stops growing, and cartilage never stops growing. It always grows. So you'll start growing, you'll reach a certain limit, like maybe you're 20 years old, but your cartilage will keep growing. And your ear is cartilage. So if you notice when you get older, you get these long ears. That's why you have something to look forward to. And the nose. So you got this long nose and these long ears. My grandfather. Right. So the teeth. In Africa, the teeth are, they have the nice white teeth, perfect. They never go to the dentist, good bone structure. That's because the trace minerals in the soil. In America, all the teeth are just cavities and it just breaks down. The facial bones aren't as robust. It's the trace minerals. So some of the countries that are very poor are rich in nutrients. What is that tree in Africa that has the most nutrition? It's called, starts with an M. What's that? No, it's called, what is that called? Starts with an M. It's a leaf. What's that? Moringa. Yes, the moringa leaf. Thank you. The moringa has, 17 times the potassium, not 17%, 17 times the potassium than bananas. It has 8 times the calcium than milk. So the moringa powder, I think that would answer your question. The moringa powder. Yes, because it's super. And the reason why it's so great is it's grown in soils in Africa that you absorb all these trace minerals. And if you have the trace minerals, you get more yield of nutrient-dense vitamins. All the vitamins have a trace mineral connected to it in the complex. Like B12 would be cobalt. But most of the soils don't even have any cobalt. So you're getting this vitamin void B12. Okay, the gums. If your gums are really pink and they're spongy and you brush your gums and you get bleeding teeth, that is a form of scurvy or gingivitis. It's a mild form of vitamin C deficiency. And do you know what causes that? Taking too much vitamin C. But synthetic vitamin C. So in nature, vitamin C comes with ascorbic acid, which is the protective antioxidant. And then it comes with vitamin J, P, that's the bioflavonoids, copper in a plant-based form, and vitamin K. This is the vitamin C complex. That's the component parts. When you get it synthetically, you just get one big ball of ascorbic acid, maybe with a pinch of bioflavonoids. When you take too much synthetic, like a gram or 1,000 milligrams or 500 milligrams, you will deplete the other factors. So if you take too much vitamin C synthetically, which is made from cornstarch and sulfuric acid, you're going to start getting deficiencies in vitamin P, and there goes the gums are going to get red, swollen, and bleeding when you brush your teeth. So that's the problem, is that the synthetic actually creates the problem. Also, vitamin J helps your lung. When you go up an incline, you have good wind. That would be vitamin J, because this is the anti-pneumonia vitamin. It protects your lungs from viruses and things like that. Copper supports your adrenals. Every single organ in your body is very selective with nutrients. In other words, certain trace minerals will go to certain parts of your body, like iodine goes to your thyroid. Vitamin E goes to your pituitary gland. So you have different minerals that support different things. Now, I have all of this data in a series of videos on a little tiny course that I think all of you should do. And I'm going to write down the address of where to go get this and download the little PDF document that you can have all this in one chart. Berg.com/. See, it's Be Health Coach /. Try to read that from. So if you go here, you can see all these videos, and you can also download the PDF that has all of this data on one piece of paper.
I was just going to say to everybody writing it down, you got to do it exactly, uppercase, lowercase, and all like that, or you'll never find it.
It's all lowercase, sorry.
Everyday vitamins that we purchase may not be beneficial as we may think, or what?
So he had a question. He says, getting back to the vitamins, do you think the everyday vitamins are not very beneficial, like the one-a-days?
Multivitamin and all that stuff.
Yeah, correct. Yeah. They're made from synthetics. They're made from coal tar. There's a common communication out in the so-called scientific world that there's no difference between synthetic and natural. And those people that are touting that are usually in a laboratory with a white coat and doing experiments with rats or whatever. And they really never work with a patient to test out these theories. They're in a chemistry lab. And so what's missing in healthcare is really the health part. Other than that, it's perfectly fine. So that was being sarcastic. They don't have enough health, and so they use synthetic vitamins. And you want to read the labels, because it's really tricking the consumer, because you're not really getting the real thing. Do you realize how inexpensive these synthetic vitamins really are? I'm talking, you can get a gallon of vitamin B1 synthetic for probably a penny. It's so cheap because it's made from coal tar. And so they make these astronomical profits. So there's really very little profit in making a whole food vitamin. So that's why it's hard to process, it's hard to grow it. So you don't see very many around.
So what is the best way to get vitamin B12 if you know, you're not a meat eater, you're a vegetarian, and because I take B12 capsules.
Nutritional yeast is probably a really good way to get it.
How about iron?
Are you a vegetarian?
I am. I have an iron deficiency.
That's
from
a tough
blood
one.
Loss.
That's a tough one. You wouldn't, so you're not going to be, of course, because usually it's in like red meat, so you're not going to do that. So you could do eggs at all? Sometimes? If you have, like beets have iron in them, plant-based minerals, anything red, but typically, this is what I found, people that are consuming enough vegetables and they're still anemic, it's really coming from their stomach being too alkaline. So when the stomach is not the right pH, you can't pull in the iron, the calcium. That's why you might have cramps, you might be anemic, you might get bloating. So you might want to try having a little apple cider vinegar in your drink, apple cider vinegar, and you just might become non-anemic just from that alone. Because it's going to acidify your stomach and you're going to start absorbing more minerals into the system. See, just because you consume the vitamin doesn't mean it's not mobilized. It has to go in with a certain acid level. So if your body pH is too far one way, you can't absorb the minerals or get the nutrients in. Yeah. And every decade you age, it's harder and harder to absorb nutrients because you lose your pH, your acids. Yes. I would just take them, put it in some of your water. Put a teaspoon per glass of water and just add that to your water for a while. And you're going to find that you're going to absorb more calcium and iron and minerals and things like that.
Is it backstrap molasses a good source of iron?
Yes, if you're not trying to lose weight and you don't have a blood sugar problem, because there's a lot of carbohydrate in there, but there's a lot of vitamins too. If you take cane sugar, which has tons of potassium and tons of nutrients, and you refine it into white sugar, and they shoot away or they disregard all the good nutrients, and they call it blackstrap molasses. That's actually, there's a lot of nutrition in there, and that wouldn't be a bad thing to do maybe if you're anemic, but this sugar, it's pretty concentrated in sugar. So you'd be better off if you chew on the cane sugar. That would be the ideal scene if you have good teeth. Now, the tongue. If you have a fissure down the center like that, like an earthquake, a very deep one, that is a liver problem and it's a B12 problem. It's like they call it an earthquake tongue or what do you call it? Geographic tongue. So it would be B12 deficiency. If you already have that fissure, it's very hard to correct it. So you want to prevent it by consuming it when you're a small child. You give it to your kids. If the tongue is white, that is a yeast problem. That's usually coming from years of using antibiotics. If your tongue is red and glossy, that's a liver problem. It's a B2 deficiency. Let's see here, you've got the tongue. Yeah, so that's pretty much it for the tongue. And then your nails. That little red spot, that's a zinc deficiency. Zinc is a trace mineral. And zinc is it's very difficult to get zinc in our food nowadays because the soils are so bad. But zinc is a great way to help suppress viruses for your immune system. If you have a child that has a fever that comes from a virus, or you yourself have a fever or you have a virus, take some zinc and it tends to put it right back in remission because it strengthens the cell wall. It's good for the immune system. It's good for preventing deficiencies. It's good at the cellular level, and it's without zinc, over 100 enzymes that help you break down proteins and build back up proteins are inactivated. So lots of problems with growth. Growing up as a child, you can have stunted growth if you're zinc deficient, and also iodine deficiency as well. So these trace minerals are really important in your growth of your tissues and your bones and your muscles. Okay, good. No questions on that one. Also, one of the ways that you'll know you're zinc deficient if you can't smell anything, or your taste goes down. You lose your taste and you lose your smell. That's a zinc deficiency. So this is a zinc deficiency, but guess what depletes zinc? Carbohydrates. Breads, pasta, cereal, crackers, biscuits, waffles, pancakes, muffins, sodas, juice, alcohol, Mad Dog 2020. All of those carbs will deplete zinc and create little white spots.
Even the whole wheat breads?
It depends. If it's sprouted, if it's Ezekiel bread, which is the ultimate bread, if you make it, you're probably good, but make sure you grind your own grain. Okay. When you take the seed of the grass, which is grain, and you grind it, The vitamins will last for 6 days. But if you buy the flour from the shelf, it's been sitting on the shelf for 6 months. Now, in order to preserve that flour, they have to spray it with 4 times the bug sprays than they would white flour because it's more nutritious. So you're getting more chemicals with whole wheat bread than white bread. Unless you're doing Ezekiel bread or some frozen bread or sprouted bread that you would consume that from a health food store. But the typical stuff, you go with the Giant, you see the whole wheat bread, it's not going to help you. I'm sorry. Am I killing you? Killing softly within you. Yeah, we were grinding our own grain. We had a little grinder. There's nothing better than freshly ground grain and fresh bread out of the oven. I have to admit.
What about the fiber in the whole wheat bread?
The fiber in the whole wheat bread that's been sprayed with synthetic pesticides might give you, well, see, fiber is not a nutrient. It's a bulk thing that will maybe help your digestion. I would recommend getting your fiber from the vegetables. Those 10 cups, remember? We talked about that. That's a lot of fiber. But to actually get the fiber from the grains, now some people say, well, bran helps me go to the bathroom. It's not the fiber that pushes anything. It's a little trace bit of B vitamins that help stimulate the colon and help push it through. It's not the fiber. Fiber just sits there. Now, it is true that your bacteria live on fiber and they use that as food, but they really want the vegetable fiber. If you don't feed your bacteria the right fiber, those microbes don't grow. And that is why lots of people that get bloating with cabbage, broccoli, Brussels sprouts, and they bloat because they're not used to building up. They haven't built up those bacteria to digest those heavy fibers. So if you do bloat, have a little bit in the diet and gradually kind of pick it up until you build up your microbes. It's not an allergy, it's a lack of microbes that are supposed to break down those fibers.
Question?
Yes.
Dr. Berg, what makes Ezekiel bread stand out from the other options?
It's a very high quality sprouted bread with very a wide range of grains that have low carbohydrate, high in protein, high in nutrient. And they have to freeze it because it's so fresh. It goes bad so quick. So it's very earthy. Now here is the real problem. In medicine, they make the symptom the problem. That's really what the problem is. It's like you have low back pain. Now what they do is they convert it to Latin or a very complex name. You have lumbalgia. If you break your back, you have spondylolisthesis. Wow, it sounds very scientific and complex. And then they treat it with a poison. So the symptom is not the problem. You got to go deeper. They say, well, you have, like there's a disease called dysstatokinesis. That means you can't rotate your arm. Okay, why don't they just say it? They have diseases called iatrogenic. That means physician-caused illness. They can't tell you what that means. They just, you have iatrogenic disease. I'm like, oh, okay. Idiopathic means unknown cause. Idiopathic sounds more important. They have one now, and I'm not kidding. It's called non-compliance to treatment disorder. I'm serious. If you don't comply with the treatment, we will label you as we can bill that. Non-compliance. What if you don't want the surgery? Sorry. They have things called fibromyalgia. That means you hurt all over. Okay. They have things called plantar fasciitis. That means you're hurting your foot. The bottom of your foot hurts. So they make it very, very mysterious and complex. And then we have specialists for every different part of your body to even make it more important. So it's very simple when you look at it. So what we want to do is realize there's a big difference between a symptom and the problem, cause and effect. So we want to do what's called an evaluation. So we want to ask questions. Okay, what's behind this? So when you go to your doctor, just realize that when they tell you you have high blood pressure, we're going to treat it, say, well, wait a second, what causes that? Get the real reason before they start going in there and treating. I mean, and the reason I'm saying this is just because all day long, I listen to these stories that would literally make you just, your head spin. Incredible. I'll give you an example. Oh yeah, this patient. There's two sisters. One gal, she had breast cancer, but the other one didn't. But the doctor says, well, you're at risk because your sister had it, so we're going to do a hysterectomy. So they took out the uterus, but they also did the mastectomy too. They took out the breast, just to make sure she didn't get breast cancer. The problem is, though, when they did the surgery, they tried to take the belly fat that she wanted to transplant into the breast because she thought that would be a good idea. To maybe kill two birds with one stone, just maybe take my belly fat and put it in my breast. Well, the breast rejected that. So she was in surgery for 18 hours, and then she was in a coma. I mean, so many complications, and now it's been months and she's still draining. It won't heal. So she's trying to solve a problem, but she's trying to solve it with something very invasive. Well, guess what? In nature, cruciferous vegetables will significantly reduce the chance of cancer. So instead, the doctors use tamoxifen, which is a drug to block estrogen, but why don't they use the stuff that is even more powerful, cruciferous vegetables? That's anti-estrogenic, so that will lower your estrogen and actually protect you against things. So really what you have to do is you have to start creating your health right now, because what happens, it's like, well, let's test you in 6 months. Everything's fine. Let's test you in 6 months. Oh, you have it. Why didn't they prevent it right here? That's really what I'm seeing the challenge is that there's really no real prevention other than aspirin a day, which is not really prevention. It's just thinning your blood. So you have to actively build up your health every single day to avoid things. You want to learn from other people's mistakes. But you ever see these commercials? It's like, ask your doctor about this drug. It may cause... And I'm like, what the heck? I don't know. Are people that stupid to just gonna keep asking the doctor, should I take this? Okay. Yeah. So you have clinical depression. Well, maybe it's you're not sleeping. You know? Maybe see, they don't recognize the connection between what you eat and your health. There's no real importance on that little connection. I'm telling you, it's huge. I mean, you could literally turn someone's health around. I mean, it's just miraculous. This guy came in, he's a teenager, acne, puffy eyes. He looks like he's 50 years old. I mean, like, not that that's bad, but he looks old, older than he's 20. So we changed his eating. That's all we did. I mean, the guy, all of his acne's clearing up. His eyes are clear. He doesn't look, he looks good. So he never ate a salad. He never ate one bit of vegetable in his life. So amazing. Now, estrogen, your hormones, well, let's just talk about estrogen. Estrogen dominance, that means too much estrogen, will create heavy periods, okay? Irregular periods, and also crampiness and PMS. How many of you know what PMS is? Okay. Anyone know anyone with PMS? Okay. Husbands are like. So, irritability, weepiness that time of the month, bloating, headaches, all that is all estrogen dominance. Well, all that estrogen does is it makes fibroids. So, fibroids then make estrogen. Estrogen makes fibroids. Estrogen makes fat. Fat makes estrogen. It goes back and forth. And where does this estrogen come from? Does anyone know where estrogen comes from in the environment? Soy. Especially soy protein isolates. not as much as the tofu and the tempeh, but the soy protein isolates, that's in all the diet foods, the prepackaged foods. It's in the veggie patties. It's in the vegetarian meats. The problem is that the Chinese never really ate that type of food. We do, because it's easy, it's cheap, and I found a lot of problems because it spikes estrogen, and it creates problems in your liver and fertility and things like that. You try to be healthy, so you stop eating meat, and all of a sudden you end up with another problem. So you want to have fermented soy if you're going to do soy, but you got to realize that most people are so estrogen dominant because of all the chemicals in the environment, pesticides that mimic estrogen. That's really the problem. We're just bathed in estrogen. Yeah. So men are getting breast tissue. Men are getting breast cancer. Women, young girls are go through menstrual cycles earlier and earlier. Kids are getting bigger feet. They're getting like deeper voices. Like at second grade, you're like, you have a mustache already in your second grade? So hormones can really affect your body. You want to answer that for me?
Soy milk, just soy and water, natural, unsweetened.
No. Next question. Now, the problem is that, is it fermented? Then it's good. Okay, if it's Whole Foods, it's okay. I'm just being sarcastic. Doesn't mean anything. I mean, in fact, a lot of the foods at Whole Foods are commercial. There's nothing special about them. They're just very expensive. So you want to understand what you're putting in your body, and estrogen tends to, soy milk tends to increase estrogen. And the reason I know that is because, not just because I read it in a book, but I had patients that come in. I had 2 male patients that were drinking so much soy milk, they were lactating. Breast milk. That was enough for me to cut down a little bit. Now, I completely cut it out. So maybe you want to try almond milk. They have plain. Another question?
Rice milk.
Well, that's definitely better than soy.
But they just came back with what they're putting in rice. They're finding it in the white and the brown rice.
Yeah.
With arsenic.
Arsenic? Yeah, and GMO too, unfortunately, genetically modified. Which don't get me started on that one. But there's a lot of foods. The 4 foods that are nearly 100% GMO, genetically modified: soy, corn, canola, and wheat. Those are the 4 biggies. Those are genetically modified by Monsanto. So they do Agent Orange. They did aspartame. So yeah, genetically modified. I'm just seeing a lot of digestive problems with genetically modified foods.
A question back here, Dr. Berg.
Yeah.
What about coconut milk?
Wonderful. I think it's great. Yeah, we could finally eat something. Yeah. I'm just trying to figure out, there's not a lot of coconut juice that comes out of a coconut. They must use a lot of coconuts to get the amount of coconut juice that they're, like, where are they getting all these coconuts? It's amazing. But coconuts are coconut flour, coconut meal is actually very, very good. Coconut oil is very good for you. So that you can use that as your flour instead of wheat flour, because of some people have a problem with digestion with the grains. Let me see if I wanted to cover. If you are B1 deficient, okay, here's a little symptom. You're gonna get a nervous tension. You're gonna feel very on edge, like a lot of buildup of just anxiety. If you have that, you're B1 deficient. And if you took some natural B1 or you took some nutritional yeast, you would feel a lot calmer. So those people are very edgy. They're irritable. They kind of overly critical. They have a low tolerance to stress. I don't know if you know anyone like that. Maybe a next door neighbor or something. So just have some nutritional yeast because stress depletes B1. Mental stress depletes vitamin B1. But don't take in synthetic. Get a natural source from the nutritional yeast. And I think they have the nutritional yeast flakes. I think it's Bragg's. That's pretty good, isn't it? And then calcium. Oh, another symptom of B1 would be nightmares or very active dreams. You're B1 deficient. And then calcium deficiency would be that you're really tired, but you can't sleep. Like your head's tired, but your head will not wind down. You are thinking so much when you're trying to sleep. That's a calcium deficiency. Calcium deficiencies will also cause an inability to breathe, like you can't get enough air, like you're suffocating at night when you're trying to sleep and you just can't get enough air. Of course, you have the cramps in your calves, that would be calcium, but don't take the calcium carbonate because that would be limestone. You'd be better off chewing on the cement on the building. Electrolytes. If you're electrolyte deficient, you're going to get fluid in your ankles. All that means is the electrolytes are little minerals that are electrically charged to help push fluid through the body. So if you're deficient, they're going to sit down in your ankles and it's going to be really hard on your heart because the fluid can't go through. So how do you get your, where do we get electrolytes? What's that? Gatorade, exactly. Yeah, the high fructose corn syrup. You want to get your electrolytes from lemon water, like get some lemon and put it in water, or apple cider vinegar in the water, or the actual 10 cups of salad you're eating. That'll do it too. You can also, what else can you get? You can do any of the coconut water, any of the melons will do it too. I mean, if you took some melons before bed and you woke up, your ankles, your fluid will go way down. Yes?
I was told that you can also replace electrolytes by putting a little sea salt in water and drinking it. Is that true?
Yes and no. There are electrolytes, but what happens is that there's a bit too much of sodium in that mixture. It's not enough potassium. So you want to have sea salt in your diet for sure, but it won't be the perfect source of electrolytes because you need a bit more. You actually need 4 times as much potassium as sodium. It's interesting. But what normally people do is do heavy on the sodium and light on the potassium. And where do you get that? Popeye's Chicken, 7-Eleven, all those places that are really salty, it's just so much sodium as MSG, which is a whole different seminar. Any other questions that you have? Yes.
I just had some blood work done, and I am very deficient in vitamin D. Like
D?
Like
Okay.
30 to 100 is good. I'm a 9.
Okay.
So my doctor of course suggested get some synthetic, get your 5,000 international units a day. I don't want to do that. And what's the difference between D2 and D3? Because I'm reading about that too. So I don't know what to do. And should I try to shoot it up real quick, or should I go maybe the slow and gradual increase?
Well, here's a great example. You go to the doctor, he has the blood work, and they have high A1C, low vitamin D, and et cetera, et cetera. And then what they do is they treat each one, right? Mm-hmm. Mistake. We want to ask, why do you have vitamin D? That's the question I want to find out. I'm going to use that as a string to pull, as a clue. I'm not going to treat it. That's like valuable data. Like, why would you be deficient in vitamin D? Does she go outside? No. Okay, then let's have her go outside. A 20-minute exposure to sun would give you 1,200 international units of vitamin D from the sun, and it's just all natural, no toxic effect. I mean, you could, if you want to do a natural one, do D3 if you wanted to bring it up. But there's 2 other reasons why people are deficient in vitamin D. Number 1, the adrenal glands will cause a depletion of your vitamin D, just adrenal stress. I don't know if you ever experienced stress before. Okay, then we can rule that out. Also, if you have What else? Oh yeah, bile, digestion. Do you get any bloating? Okay, then that's not a lack of bile because you can't absorb it. So I would probably, the easiest thing to do is just get a little bit more, get outside and get sun. I don't think very many people go outside anymore. And so that's kind of a out point. And then we're staying inside and we don't get any vitamin D, and then we have to take it synthetically.
Is D3, isn't that animal and D2 is plant?
No, it's not animal.
Okay.
You can get it from other sources, but you can get it from animal, but non-animal. But D3 is the natural form. You don't want a D2. No. You want the D3. Okay. Yeah.
What about the trace minerals? What about for kids?
Oh, that's when they need it most, when you're growing. Yeah. In fact, you know when the best time to take it is when you're pregnant. Not when you're pregnant, but when you're pregnant and you take it, and that fetus growing is going to have everything they need to have like the perfect bone structure and body structure. So that's when you take it, and then take a little bit throughout the early years. And then, I mean, if I would have had that, I wouldn't have had to go to the dentist every single 5 minutes, actually.
You mentioned briefly about the alkaline balance in the body and that effect on how the body extracts certain minerals and nutrients. I had a brother who said to me to use Cajun water filters, and somehow that would create a perfect balance or a near perfect balance, and it would help you to extract various nutrients and vitamins that the body needs. Do you have any knowledge about that?
Yeah, well, it's treating the symptom again. You don't want to treat your pH. You want to use your pH as a clue to pull the string to see what's behind it. If you say what part of your body is acid or alkaline, you have urine, it should be acid, your stomach should be incredibly acid, your gallbladder should be alkaline, your saliva should be alkaline, your blood should be slightly alkaline. So you have all these different pHs. So people, when they say you should be too much of this or that, they're not telling you what body part. The stable constant pH should be, your blood should be slightly alkaline, just barely slightly alkaline. Most people that have adrenal stress, and that's pretty much 80% of the people in the room, will have they're going to be actually a little too alkaline in their blood, but their urine is going to be excessively acid because they're losing all their pH. And what happens is then you can't mobilize calcium, manganese, iron, all these trace minerals, and the oxygen goes, and the stress goes, and the muscle goes. So I found that the majority of people need to add a little more acidity to their diet, to the apple cider vinegar, and not try to change the pH of the water. When people come in and I see their pH like a 9, like their urine, I'm like, oh my goodness, you went to the extreme the other way. So it comes with a package when you try to drink certain pHs in your water. I would just go with what nature designed that water to be, wherever that is, and then drink that. You know, like just drink like in DC, the tap water, right? No, it's okay.
I have 2 questions. The first one is I had heard someone mention to me that people are having this increase in gluten allergies because of GMO wheat. I was wanting to know your thoughts on that. And also, what are your thoughts on prenatal vitamins?
Yeah. What's happened, the reason why we have allergies to wheat and nuts and milk is because we've been living on these foods that have been denatured and destroyed, pasteurized milk, refined grains. So our bodies are naturally rejecting that and creating allergies from it. And then we pass on those genetic traits to our kids. So that's really what's happening. If we never did that, we wouldn't have these allergies. Number 2, prenatal vitamins, most of them are so bad. The worst place to get the prenatal is to get a prescription prenatal from the drugstore. Oh my goodness. Try to find some baby food that's not synthetic. You want plant-based vitamins for you being pregnant. And then you don't have to worry about it because they're always in small amounts. That's what I would do.
What causes minor shaking of your hand?
That's a dopamine deficiency, and that's made either by the adrenal or your brain deficiency, and you have these resting tremor type things. Is that what it is? Do you have it in one hand or 2? One, the right or left? You want to see a little technique to get rid of that? What you would do, can you come up here? So I'll show you. Same thing you can do for phantom pain. If you ever have no arm and you hurt right there, you can do the same thing.
What you just demonstrated was not picked up, Doc, so we just need to say it again over the mic.
If you have shakiness on one side of your hand, like a tremor, you can actually work on the opposite hand to get rid of the shakiness on one side. Yep. So I want to thank you for coming. I hope you got a couple tips. Go to this little course, download the little chart, and that way you can identify your friends and family and coworkers. Just don't mention my name. Have a great afternoon. Thank you.
Thank you, Dr. Berg. Again, I would like to thank Dr. Berg for his commitment to our congregation and those in the community. He's been coming now for quite some time, giving us some very useful information. I would like to know if we have any visitors here, first-time visitors. If you raise your hand, my kids will hand you a visitor information so you can fill out for us. Then we're also asking that all of you please fill out a survey. Debbie's handing it out so that you can give us feedback on the seminar today as well as recommendations for the future. So we're going to close out, and Wayne is going to close us in prayer. And again, I thank you all for coming out, and hopefully this information will help you in your journey to getting to know the Lord's work, which is your body and keeping your body holy. Thank you very much.
I think this is different when I got up. Actually, from a distance, I thought it said educate, but actually it's advocate, ADVOCATE. I don't know if anybody else saw that, but maybe my eyes are going also. Well, again, thank you for coming, and we'll stop for a second and have a prayer. Dear Lord, thank you so much for just letting us feel the sunshine on such a beautiful, beautiful day, Lord, and have the health to get up and walk around as we pray for those, Lord, who couldn't get out of bed today, who've never gotten out of bed, Lord. We know that we should not take our health for granted, and we take this time just to say thank you, even for the problems that we do have. We pray for Dr. Berg and his continued mission, Lord, to enlighten people and bring relief and health to them and others that are doing the same work. Now let us go from here to remember what we did and try. Forgive us and save us, remembering little Madison Garrett in our prayers as well. And Sylvia, amen.
What Wayne, if you would just read that website all the way across.
Sure will. It says, Dr. Berg, BEHEALTH.P as in Paul, HP as in Paul, /MAIN/HEALTHADVOCATE. drberg.com/BeHealthCoach.php/main/health advocate. All lowercase.
I want to make sure that everyone remembers to hand in your survey. I'll be at the back door, and you can hand them in to me. And if you would like one of Dr. Berg's cards so that you can get in touch with his office later, you may do that. When you call the office, if you would ask for Joyce Valentine, that's Dr. Berg's assistant, and she will be happy to set up an appointment for you. Okay? Your first visit, your first consultation is free. And it is an extensive consultation. You will appreciate Dr. Berg even more.